Hormone balance in women is much more delicate subject and something that is still misunderstood by conventional medicine um, tremendously. If you're not old enough to be in menopause, you're probably okay. Well, that's not true. I see women in their 30s, sometimes after childbirth, some that have never had children. Environmental factors are a big deal. We see changes decades, 10, 20 years before menopause in a 30 to 40-year-old woman who suddenly is gaining weight and is tired and has no energy. I can't sleep at night. I feel more irritable. I, you know, am having trouble with my relationships. Well, we do exhaustive blood work and a comprehensive panel look at everything and see where we're at. And then also have to time it. Sometimes with younger women, I need to know when their last cycle was. And we start counting day one, first day there's no spotting. And on the 20 to the 22nd day is when progesterone peaks. And if it's 0 to 1, it should be 10. It should be much higher. And so sometimes small amounts of progesterone are dramatic, especially with women with PMS and migraines. I've had great results over the years with women with significant PMS having dramatic relief just from 50 milligrams of progesterone nightly. With after menopause, the dose goes up to 100, 200 milligrams, maybe 300, whatever it takes to get the blood in a specific range. But it's very measurable. And again, the same along with testosterone. Most women that I see that come in, their testosterone is 0 point something. And it should be between 2 and 4. It's not going to be 1,000, the same levels as men, but it could be 200 to 300 to get there, depending on how much of that sex hormone binding globulin, a protein in their blood that binds it. Only very, very small amount, 1 to 2% of the total is all that does anything in your body. And so that number is very different for women than men. And it's gross. It's always overlooked. I saw a client of mine that came in for some peptide advice yesterday, and because she's a director in Hollywood and she's back and forth to Aspen, and so she's seeing someone down there. I said, fine. She's worked with me before, and she's just been there more. And I don't care. That's okay. As long as you're still doing something, that's what matters to me. And they had her on a tiny amount, 2.5 milligrams of testosterone. I'm like, that's not enough to do anything. It's applied as a cream topically to specific areas. But what's your free testosterone? It was 0.4. And I'm like, you need about 4 times more than that. You need to call them, go talk to them and ask them, why are they not looking at this specific number? So, there are a number of things, but it's kind of the same. It's just not a cookie cutter and not the same recipe for every woman. And so we want to be very specific about it. We want to measure blood work frequently so that we can do what helps you feel your best, perform your best, back to whether you are a recreational athlete, a college athlete, or a professional athlete, or just someone who's, focused on being the best they can for their family and kids. You can't do it and it's an uphill battle without working to optimize all hormones. And again, many years before menopause, because most physicians, OB-GYNs included, are not trained in hormone optimization. I see it over and over again. I even have one in my hometown here in Aspen that has advised a number of women that I've seen to stop, that you're going to get breast cancer or this. Though that's a myth from the World Health Initiative study in 2001 done on synthetic hormones. There are now multiple studies to show that not only is that not true, estradiol and progesterone are both cancer protective for breast and ovary and uterus. And so it's it's sad that it's still out there, and it's mainstream medicine takes a long time to get up to speed with changes. I've been doing this over 20 years, and I don't see it as often as I used to, but it's still a problem for me with my patients. And so I would just say it doesn't mean that you don't have a good doctor. It means that this is not what they're good at, and they are not experts in hormone optimization. You need to search someone out that is. You can Google it through worldhealth.net, which is the informational website for the American Academy of Anti-Aging and Regenerative Medicine, or WorldLink, which is a training company in Salt Lake that I work with. They have a provider directory. If someone's been through all of Dr. Rousier's courses, in my opinion, they're an expert. I'm bringing on a new physician assistant that I'm meeting at this conference this weekend that has a lot of experience, but she hasn't. My requirement is you have to finish these 4 parts and be certified by Dr. Rousier to work in my office. And so she's excited about it and doing that. And it's just going to take her to a level where I'll have no questions about having her help me with any of my patients or seeing any new patients, on my behalf. Well, I see a lot of people via telemedicine. And so I see people all over the world, literally, and not just at our office in Cabo San Lucas, but people from Mexico, Italy, Europe. We email orders. They can take them and get specific labs done. In the United States, we can send you to any Quest or LabCorp in the country and have results in about 5 to 7 days. And then we do a consultation by telemedicine to determine what's going on and if you're a candidate for treatment or not, and then make a plan to move forward. Well, the risks are huge. To tell the flip side is that we know with all-cause mortality is reduced by over 70% with hormone balancing. Cardiovascular disease, risk of stroke by over 30%. And so what's the risk of not doing it? Early death, heart attack, stroke, aging, accelerated arthritis, weight gain, loss of muscle mass, cognitive function. Alzheimer's is huge. Women that do bioidentical hormone therapy do not develop Alzheimer's disease. Absolutely. Go to www.aspen-regenerativemedicine.com or give us a call, 970-201-1332. You find us, we'll help you.